Hi, I'm Dr. Kelly Hudson with Backworks Chiropractic in Dexter, Missouri. We're going to talk a little bit about disc problems today. The most common disc problem that people get diagnosed with is a bulge disc. Now, bulge discs are actually extremely common and they're totally normal. Most people that don't have pain have a bulge disc. Most people, at least 50% of people, depending on your age range, typically have herniated discs and have no pain. So because you've been diagnosed with a disc problem doesn't necessarily mean that that's what the cause of your pain is. So those are types of things that we want to make sure that we actually look for in an exam. The only way to really truly tell if a disc is causing your problem is through an NCV test. It's called a nerve conduction velocity test. When I have patients that have severe disc issues, I always send them to one of my neurosurgeons that I work closely with and have them basically check out and make sure that it's not a surgical case. Most disc issues can be treated conservatively because when you're talking about actually getting into surgery, a lot of those procedures can cause long-term time off of work and even some long-term outcomes that aren't so great. And so the neurosurgeons that I work with have very conservative values the way I do. They don't do surgery unless it's absolutely necessary. So let's talk a little bit about a disc herniation. So if you were a kid, if you ever took a jelly donut and pushed down on it and watched the jelly squish out the side, just like a disc herniation. Okay? Discs themselves are actually a little harder on the outside. They literally have a little jelly center, just like a jelly donut. And so this is an example of a normal vertebra, a normal segment of your spine. See, if you look at the side, the bodies of the vertebra, the bones are nice and squared off. The disc is nice and thick. You see how that is? When you have a disc bulge, what you get is this. So the disc gets shorter, closer together. It gets a little red and irritated, pooches out a little bit. Now the question is, can this kind of pooching out, can it push on the nerve and cause some problems? Sure it can. It's not very often that happens though. More common when you have a disc issue, what the pain is a disc herniation. And that means that the jelly from the center has squished out the side. And so if we look on the other side, that is a disc herniation. You see how the jelly has come from the inside and squished out? And when that jelly pushes on that nerve, that is where the pain comes. Okay? It only takes the pressure of about the weight of a dime to light that nerve up and make you really miserable. I'll never forget, I had a gal in my first year in practice that had a disc herniation. I asked her what it felt like, and she said it felt like having all four of her kids at once. So there are several treatment options when it comes to disc herniation, depending on how severe it is. There is surgery, there's physical therapy. In chiropractic, we tend to take things a little bit differently than a lot of other disciplines. And the procedure that I like to use in my office for a disc issue is different than what a lot of other offices use. We use a vertebral axial decompression, a spinal decompression, where basically what I do is I take the spine like this and I stretch it out like this and suck the jelly back in the donut, so to speak. All we have to do is create a negative pressure and suck the jelly back in the donut. Now, there are a few things that you can do at home that are pretty well, they're not 100% because nothing in this world is, but they're pretty accurate as far as telling whether you have a disc. If you have most of your pain on one side, if it goes down your leg, if it hurts to cough or sneeze or laugh or go to the bathroom, if it hurts to bend forward or maybe even like walking upstairs where you're lifting your leg, those are all indicative of a disc issue. Now, the big thing is with discs, a lot of time, if you lean back, or if you're laying on the ground doing a push-up, but you keep your hips on the floor, so you're leaning that back, and it makes you feel better, there's a pretty good chance that you have a disc. And so there are some home care exercises that we'll give to the patients, and also we'll do a decompression. So in combination between avoiding certain exercises and activities, if you have a disc, The last thing you want to do is bend and twist at the same time. So if you think you have a disc, even for a minute, no bending and twisting, no sweeping, mopping, raking. Have your kids, have a neighbor, con your husband into doing it, something. But don't, just absolutely avoid those exercises. So, in combination, we need home care exercises, making sure that the muscles around that spine are doing their job, and this decompression, where we stretch that out and suck the jelly back in the donut. Most of the time, we have very good results in the 80 to 90% range of getting people better without having to have surgery. If you are a surgical case, then it's going to be pretty obvious to us in short order. I'll send you to one of the neurosurgeons that we work with, and I work with the best in the business. So if you have disc issues, or if if your spouse or someone you know has disc issues, something that keeps hanging on and hanging on, have them give our office a call at 624-1935, and we will get you fixed up and taken care of as soon as possible. Thanks. Have a great day.